The world's governments knew very well what they were doing when in 2003 they included an article in the new WHO Framework Convention on Tobacco Control, condemning tobacco industry interference. Yet today, when the FCTC includes 174 parties, covering nearly 90% of the world's population, threats from the industry are stronger than ever. When world leaders gathered at the United Nations in September 2011 to discuss the enormous threat to global public health posed by non-communicable diseases, they noted that tobacco use is one of the main risk factors for NCDs. And they stated clearly that the tobacco industry remains the main force driving the worldwide tobacco epidemic. They were led by WHO Director General Margaret Chan.
I call on heads of states and governments to stand rock hard against the despicable efforts of the tobacco industry to subvert this treaty. We must stand firm against their open and extremely aggressive tactics against some governments. Please watch the behavior of the industry. The new litigation tactics hitting countries that introduce very strong tobacco control measures tell us this. Even an old dog like the big tobacco can learn some dirty new tricks.
New York City Mayor Michael Bloomberg highlighted how effective tobacco control has been in his city, but warned that the industry had set its sights on markets in the developing world.
By the end of the decade, the WHO expects 7.5 million tobacco-related deaths worldwide every single year. Some 80% of those deaths will take place in the world's low and middle-income nations, nations where tobacco companies have stepped up their marketing briskly. As The Economist put it, the tobacco industry is getting the world's poor hooked before governments can respond.
Tobacco industry interference is rampant in Latin America. For example, it took 3 years of tireless lobbying by public health advocates in Costa Rica to defeat the industry's attempts to weaken the proposed tobacco control law. Ecuador's comprehensive law, passed in 2010, includes most of the main provisions contained in the FCTC. But like some of its neighbors, Ecuador had to overcome years of tobacco industry interference before it could pass the law. Ecuador's Deputy Minister for Health, Fatima Franco, explained.
El segundo lineamiento apoyado por el Ecuador se refiere a la problemática del consumo del tabaco que implica un conflicto de intereses entre la industria tabacalera y la salud pública. De ahí se deriva la importancia de que los Estados miembros adopten las medidas establecidas en el Convenio Marco sobre control del tabaco dentro de sus políticas y programas nacionales.
Norway is one of the growing number of nations targeted for legal action by the tobacco industry. In her statement, Minister of Health Ann-Grete Strom-Eriksen left no doubt about her country's resolve to withstand that threat.
Reducing tobacco consumption is one of the most efficient measures to prevent NCDs. Tobacco industry has taken legal action against a number of parties to the WHO's Framework Convention on Tobacco Control, including Norway. This is unacceptable. No party to the FTC should allow tobacco industry to intimidate us in fulfilling our legal obligations to protect public health.
Australia's then Health Minister Nicola Roxon accurately predicted that big tobacco would entice governments to file a complaint at the World Trade Organization against her country's plain packaging measures. In 2012, Ukraine and Honduras launched such actions. But as she held a model of a plain package, Roxon urged other countries to fight back against big tobacco.
There will be no brands or no logos and no colours. In fact, I have a mock-up here of what tobacco packs will look like in Australia when these laws come into effect next year. Australia is the first country to have taken up the WHO challenge to take this step. As a result, the big tobacco giants are fighting desperately through massive advertising campaigns and threats of legal action. They're fighting vigorously because they know that plain packaging will hurt them through reducing their sales. And they know that if Australia succeeds in being the first country to implement these laws, we won't be the last. The Australian government is very confident that we can withstand these threats and challenges. In fact, the more that tobacco companies fight, the more we know we're on the right track. Fighting back, as Dr. Chan said this morning, against big tobacco does require resources and political will, but saving lives and improving the health of the global community as an investment that will pay a huge dividend. And so today I urge all of you to consider how your country can take the next steps too, using the Framework Convention on Tobacco Control as a mechanism for reform. The fight against big tobacco is one which together we can win.